I think we'll get started. Thanks everybody for coming on this Monday morning. I know it was a bit nasty out there, so welcome you and really appreciate that you're here today. My name is Caitlin Johnston. I'm very pleased to be facilitating this E-Symposium, Collaborating Approaches to Promoting Newcomer Health, on behalf of the Affiliation of Multicultural Societies and Service Agencies, AMSA. AMSA is contracted by the Immigration, Refugee and Citizenship Canada to provide support to BC immigrant sector service sectors. AMSA would like to gratefully acknowledge the support of the Government of Canada who have provided the funds to make this E-Symposium possible today. So as a population and public health researcher and a program manager for BC Women's Hospital and Health Centre, this topic is not only important to me, but also what I would consider to be highly relevant. Canada and BC have for decades been destinations for newcomers. However, given the recent influx of new refugees, mostly as a result of the Syrian wars, I think this is the appropriate time to take pause and examine the systems by which we recognize and welcome women and men in families into Canada and British Columbia. At BC Women's, we offer services specific to newcomer women. However, in developing our programs, we've come to understand and recognize that health is not something that just travels with individuals as they come into new countries or as they migrate into new places, but in fact, settlement and the process of settlement is an important determinant in the determinant of people's health outcomes and how that affects them not just as individuals but as families, and it also defines their ability to succeed in their new home. Therefore, a discourse on collaborative approaches within and across sectors is highly important. Today's symposium is part of AMSA's series of knowledge-sharing meetings designed to engage settlement service providers in exchanging information relevant to settlement. The E-Symposia format was purposely chosen so as to allow service providers from across BC to attend. This series supports professional development as well as an opportunity to share challenges and celebrate successes in providing services to newcomers to British Columbia. In attendance today, we have representatives in person at SFU's Harbour Centre from the settlement service sector, from the health sector, and students from the Faculty of Health Science. Online, we have a number of agencies from across BC represented. Folks online will have an opportunity to participate, as will persons in this room, as we will be opening up the floor to questions and comments at the end of the presentations that will be of the three speakers that we have in attendance today. Online attendees will have the opportunity, and I'll put this up later, to submit their questions by email and by Twitter. The format of today will include three presentations, as I've just mentioned, representing a variety of views on the theme, Collaborative Approaches to Promoting Health, Newcomer Health. After the speaker's presentation, again, there'll be opportunities for questions and comments. Not only will the room be able to participate, but also our colleagues online, and they can do so by either emailing to events@amsa.org or using their Twitter at #AMSAevents or at AMSA BC. We will rotate the questions from in-person to online, so there'll be equal opportunity for everybody to participate. Just a gentle reminder before we move to our first speakers is to those that have cell phones, please turn the ringer off, put it on to vibrate. If you need to respond to your phone, please do so by leaving the facility, because this room, for the purposes of the online folks, any residual noise will be picked up, and so the folks online, not only will you bug the people in the room, but the folks online will also hear your whole conversation. The microphones are much more sensitive than if we were just in a regular lecture hall. Okay, so I want to introduce our first speaker, PhD candidate Ann Peterson, Director of Population Health Promotion at BC Women's Hospital and Health Centre. Ann Peterson worked at the Centre, has also worked at the BC Centre for Excellence in Women's Health in a number of roles, and the last as co-director of the Centre. In 2013 to 14, BC Women's contracted Ann and her team to conduct a project to understand the health needs and care experience of newcomer immigrant women in British Columbia. The project resulted in the creation of fact sheets and videos to help newcomers Newcomer Women Navigate Health Services in BC, and a mobile electronic resource to support healthcare providers to engage with diverse patients. Anne has been active in health promotion research and practice for 30 years and has published several co-edited books, most recently, Making It Better, Gender Transformative Health Promotion and Women's Health, Intersections of Policy, Research, and Practice, both by Canadian Scholars Press. Excuse me, sorry. Welcome, Anne.